My husband was diagnosed with an ascending aortic aneurysm.
The very first thought once they told me I had an aortic dissection was that I was dead. I was done. My father had died in the hospital of aortic dissection. They couldn't save him, so I figured they couldn't save me.
What my husband was born with was a bicuspid aortic valve. It's estimated that 2 out of every 100 people, 2% of the population, are born with that. And that's just one of many reasons why people could have thoracic aortic disease.
Within a few hours of being born, Derek was diagnosed with a heart valve defect. At that time, doctors explained that the condition would only get worse. But 2 years later, miraculously, Derek's condition had improved and surgery would be delayed for the foreseeable future.
I kept feeling some weird pains in my chest, and I just knew it wasn't right. I kept saying, Mom, we need to go get this checked out. I just felt like something wasn't right.
It was detected that his aorta was starting to become slightly enlarged, something to keep an eye on, and it became apparent that it was aortic aneurysm and was a significant concern.
This patient underwent surgery, had a complete resection of ascending aorta, and received a bovine aortic valve. Within about 3 days, he was discharged from the hospital. After a period of recovery, a few months, he went back to the basketball court. And he has become one of the best players in his own state. And it is a remarkable story that the coach mentioned that this young player has never played so well that he played after his surgery.
This is a case that exemplifies one of the things that we do a lot here. This is the aorta, and these are the great vessels that go off to the head and to the arms. The head is up here. To orient you, the head is up here, the feet are below. And the aorta comes off, gives off these great vessels, and then you've got this huge dilatation, which is called an aneurysm, and it's got calcium in it. And then the aorta continues on to normal caliber over here, and you can see it over here. But this is life-threatening. When this aorta gets over 6 centimeters, it is very prone to rupture. And people come from far and wide. This is the kind of work that is done here.